This is Functionally Feral, the podcast where two college roommates turned chiropractors, clinic owners, and crunchy moms talk about running functional businesses while raising feral children. We're Felicia and Natalie, home birth enthusiasts, holistic rebels, and slightly unhinged multitaskers who believe in nervous system regulation and toddler negotiation. Join us each week as we crack up and crack facts, swap stories from the trenches of motherhood and entrepreneurship, and explore all things holistic living, healing, and hustle, with zero shame and lots of laughs.
Hello and welcome back to episode 12.
Hello, Felicia.
Hey, Nat.
How's everything going today?
It's been a good week.
It has been a good week, but we have some things to address.
Some hot topics.
Some serious stuff.
I just said hot topics and it reminded me of the store we used to shop at. Well, I didn't shop there. Oh my gosh. I would have never.
I would like walk by it in the mall and be
I don't
like,
think it was allowed
who
inside
goes
of
in
it.
there?
Yeah.
Mhm.
It's like, I
It's
don't want to be caught.
not our MO.
Not our MO for the shopping, but today's hot topic
But we
is
do
our
like
MO.
we do like hot topics, that's for sure. So we have some things that we have to get off our chest.
We have to. We can't let you listeners go.
Because we have opinions and they deserve to be heard.
Yeah.
And we're basically titling this episode and potentially a few others.
A new series is
a new
emerging.
Series of Felicia and Natalie. A new series called What Would Felicia and Natalie Do?
What would we do?
We're taking a few different scenarios and we're going to kind of give you guys what our thought process would be behind that scenario and what would we do? What would we take? What would we give? We're talking like ailments and
how would we address it? What's our medicine cabinet looking like these days?
Literally what is our medicine cabinet?
Yeah. And truthfully, like Giuseppe knows what quote unquote medicine is these days.
Oh yeah.
Like I call his things medicine. I say,
yeah.
ready for medicine? Because medicine is supposed to be healing.
Helpful, healing, adaptive with the body.
Not suppressing.
Correct. That's how we think. So let's dive in.
Shall we? Let's start off with a little history. No, not some history. Let's start off with current events. So last week, the president, Mr. Trump, and his cabinet and the NIH.
Secretary Kennedy and everybody. Yeah.
They basically came out and said that they are now going to, proceed with saying that acetaminophen, Tylenol, is not recommended during pregnancy. And if it is used, that it should be used in the least amount possible.
The lowest
for the
dose.
shortest. Yeah, the shortest amount of time possible.
Let's also preface this by saying they are announcing this based on preliminary data that I don't think has fully been released yet. So I think there's more to come.
There's more to come.
Like all good things. Just purely a precaution that's been blown out of the water, truthfully.
Truly so hot.
So hot.
So hot. And people are so enraged by it. And it baffles my mind.
And I watch this and I go, I'm sorry, where's the confusion?
Why are we mad?
I'm so confused.
They're literally like, be cautious. And everyone's like,
I'm going to down a whole bottle of Tylenol while I'm pregnant. What's happening?
Where was your caution and where was your skepticism when they said stay 6 feet apart from each other?
Holy moly.
What? Why are we freaking out that people are like, be cautious, use the least amount of Tylenol as possible? And everyone's like I want more.
I know. Like, is this that controversial to just say you're pregnant and maybe you should be thoughtful on what goes into your body? I'm so
take a beat,
blown to pieces about this.
Yeah, I don't do this often, but I had to unfollow some people this week.
I know.
And it's simply because they're gaslighting mothers into thinking that they can't make their own choices. And I'm like, wait, what? They're literally like, if you're like listening to this advice, if you're part of the disgrace and the uneducated mothers that are listening to this advice, I'm like, That's called gaslighting.
This study is from Johns Hopkins.
Also, it's
And
called use discretion. If you don't wanna take
yes,
Tylenol, you don't have to take Tylenol. They're not
yes.
telling you to take more.
No.
They're saying take less. Do less,
You can
America,
still
do
make your
less.
own decision.
Yeah.
Oh my god, I don't
It's crazy.
understand.
So the fact that it got super heated and political is wild, but Natalie and I are here to show you that there are alternatives to reducing fevers, why we have fevers in the first place, to reducing pain, why we have pain in the first place. All these things, we have a medicine cabinet and we have
Mhm,
options for us.
mhm.
And again, it doesn't have to be political. It can just be
No.
this is what you're choosing for your family and you can make your own choices.
Yes, and also newsflash, this isn't new.
Newsflash.
Been aware of this for,
Centuries.
maybe my entire life. I
Yeah.
mean, it just wasn't
Natalie's at a loss for words.
something I don't even know. I understand I grew up a little different. I have a different point of view,
Yeah.
but, like, my whole premise of my life is is least invasive to most invasive, okay?
Start
Can
small.
we figure out maybe, like, why do you have a headache?
Mhm.
Just purely that.
Yeah.
Why do you have pain? Why, like, can you try drinking a glass of water?
Water fixes a lot of problems, let's be real.
Have you had some electrolytes?
Yeah.
Let's start there, and then we
Mhm.
can slowly build our way up as things are necessary. So,
Correct.
like, my personal experience with pain relief is that I maybe have taken Tylenol once in my entire life.
Whoa.
Once. I've never taken Advil.
That's hot, Natalie.
I never have I ever taken Advil. One time of
Cool.
Tylenol, the only time was when I had a kidney stone, and I wish I didn't because it didn't even touch it.
Oh,
So it was stupid.
yeah. And
I
it just stressed
wish
your kidneys and
I
your liver.
wish I had homeopathy at that time.
Yeah.
I wish I knew more
When did you
because
get into homeopathy?
probably when I was pregnant.
Oh.
Yeah. So I really my mom had used, like, certain remedies,
Yeah.
just, like, random ones, like pulsatilla
Yeah.
for, like, my life,
Yeah.
but it was never, like, a huge part,
It wasn't
and
like a
then I
medicine
started
cabinet.
no, and then I
Yeah.
started diving in, but, like, again, we didn't really have a traditional medicine cabinet at my house anyway, like, the medications, over the counter stuff, that wasn't an option for us really,
Mhm.
and we survived really well. We had
Yeah.
chiropractic, and we had good food and
Mhm.
nutrition, and there weren't many times that we needed more,
No.
okay?
No.
Because we have so many things at our disposal. We have so much control over we have so many options if you
Yeah.
really dig and dive.
Yeah.
So that's, I guess, where I'm coming from. So this whole
Mhm.
thing I don't understand at all, but I
I know. What like
understand
why people
that
are mad. I'm
if
like,
Tylenol is your only thing and you're pregnant and that's the only thing that you've been told is safe, quote unquote safe,
yeah.
I understand that this could be a really, really tough
Shocking
topic
moment.
because it's like, what do I do then?
Yeah.
But we're here to tell you that there are so many options.
Okay,
Okay.
Natalie's taking the calm road. I'm so hype about this. Natalie's like, we're going to sit and hold your hand, and I'm gonna be like slamming a book in your face.
Do what
So
you need to
sorry.
do.
No, it's fine. Yeah, I mean, there are so many reasons why your body is presenting the symptoms it's presenting. Like symptoms
Right.
are essentially check engine lights.
Yep.
You get a headache, that's the check engine light that comes on that says, "Hey, you need to dive into what the cause of the headache is." Like we said, are you dehydrated? Are you mineral deficient? Do you need electrolytes?
I
Are
have seen
you
so many chronic migraine patients that
Yeah.
get better within 2 days of adding a mineral supplement or
Right.
trace minerals to
Mhm.
your water or electrolytes, whatever
Mhm.
form.
Right.
It can do wonders.
Exactly, and it's like, if we can just trace backwards to the
Yep.
check engine light and figure out why you're having the pain and the fever,
Yep.
then you don't need to just mask it with a Tylenol because the Tylenol is not solving a problem. The
Right.
Tylenol is masking. So essentially what Tylenol does to the brain is it raises your pain threshold. So it's not fixing the problem. It's just making your brain less aware.
Right.
Whew.
Not to mention all the than side effects that are coming from Tylenol.
Oh my
Like,
gosh.
so bad.
Your poor liver.
Can
Your
we talk
poor
about that
liver.
for a second?
Yeah.
So Tylenol, it massively depletes your glutathione levels. And glutathione, for anybody who doesn't know, is maybe one of the most important compounds in your body to
Yes.
make sure that you have something that can help your liver.
Mhm.
It's working in your liver to help your body detoxify and get
Mhm.
out the 20,000 chemicals that we're exposed to every day.
Yeah.
Like
It's called
we are
an
so taxed.
antioxidant.
Yes, it's the master antioxidant. We are so
Yes.
overloaded with toxins in general that if
Mhm.
you don't have glutathione working even like a little bit, like you will die.
Yeah.
And this
No,
is
it
why people
literally
actually
is.
die from taking
Too much Tylenol.
six Tylenol. It doesn't even take much. You can
Mhm.
overdose from like 4 to 6 Tylenol depending on your weight.
Mhm.
One Tylenol, one normal strength Tylenol is
Mhm.
equivalent to drinking 6 alcoholic drinks.
On
Did
your
you know
liver.
that?
On your
Mhm.
liver.
That's
Yeah.
that's the glutathione reduction
Mhm.
and the overall stress on your liver.
Oh,
One.
and then get this. People drink the night before and then they take a Tylenol to fix their hangover and their liver is literally being squeezed
It's
to
shriveling.
shrivel and it's being wrung out dry.
Ugh.
And then we wonder why we have problems. But
Right.
I just I'm getting sidetracked because I'm getting so heated. I'm sweating right now. I don't know where I was gonna go with that. Oh,
Um,
so glutathione and, like,
yes.
antioxidants. So a huge thing in, like, trendy nutrition culture is, like, eat your antioxidants, like blueberries or get your acai bowls.
Your colors.
It's like,
Mhm.
no, just, honor the liver that you have and don't treat it poorly, and then you don't need to do all these trendy things.
Mhm.
Your liver produces antioxidants.
The appropriate amount.
Yes, and so, I mean, yes, you need to eat your rainbow, and yes, you
Of
need to eat
course.
healthy foods, but, like, we don't need to counteract a night of drinking with eating an acai bowl.
Right.
Let's be real.
Let's be real.
Let's be real. Okay,
I
so
guess it's better than counteracting a night of drinking with a Tylenol.
our advice, eat an acai bowl over taking your Tylenol. Yes, but
Okay, also be aware, we're not just talking about Tylenol here.
right, right.
Acetaminophen
Sorry.
is in so many
NyQuil,
things.
DayQuil.
So many things.
Mhm.
Be aware. Okay.
Yeah, no, the other thing so speaking of glutathione, maybe let's start off our first hitter, coffee enemas.
Oh, yeah.
So, circling back to episode 1 no, episode
2,
2
yeah.
episode 2 about detoxifying. So, coffee enemas, utilizing the benefit of, like, your hepatic vein and
Yep.
palmitic acids and things like that, it boosts your glutathione in your liver. It helps your liver squeeze out
Mhm.
600 to 800% more glutathione.
Crazy.
It's about 700%, but depending on
Yes.
how long you hold and, like, all the, like, little
That's
nuances.
amazing.
It's insanity. So, if you can boost your glutathione naturally using a coffee enema,
Yep.
that can fight off tons of inflammation in the body. It can fight off tons of precancerous cell. Like, it literally goes to war for your body.
Yeah.
So, that's a good starting point. If you're like, "Okay, I need, like, antioxidant things in my body right now."
Yeah. Okay, real
Coffee enema.
question. Can you do that while you're pregnant?
You can't do it while you're pregnant. Well,
Right?
actually, you can, but I'm not gonna tell you you can.
Yeah.
I've had patients that do it.
Yeah.
I'm a little bit more cautious on it as far
Yeah.
as coffee goes. You
Yeah.
can do it, but I don't. But I
You can
also
do a regular enema, but
yeah, I
yeah,
also, like I'm a little bit more cautious on all things when I'm pregnant, as I think
exactly.
everyone should be.
Yes.
Everyone should be more cautious when they're pregnant. You are literally
Yes.
creating life. You should not be
Yes.
just willy-nilly doing things.
Yes.
But in the grand scheme of, like, boosting glutathione, the most straightforward route of doing that without consuming glutathione as a
Mhm.
supplement is to do a coffee enema.
Yes.
So,
In general, we're just trying not to deplete our bodies also
yeah,
and
we're trying
just,
to
like,
boost our
treat it
natural
well.
yeah, yeah. Okay, so let's talk about, your reasons and explanations for fevers,
Yeah.
and then how we can address those in
Yeah.
pregnant patients or pregnant people, and children.
And children. Yeah. So fevers are just such a they're triggering subject
Hot
because
topic, shall you say.
it's another hot topic, literally.
I wonder if that's where that came from.
I don't know. There are so many people that have a lot of fear around
Mhm.
fevers. I am not that person. So
Yeah.
I'm going to come at this from a person who I don't even know if I own a thermometer because I
Really?
because I don't care about the number.
Okay.
I truly don't.
I own a thermometer.
I do somewhere. If I
Okay.
had to find it, I would find
Yeah.
it.
Yeah.
But I'm not concerned about the number at all.
I've not taken an adult fever temperature in a very long time.
Yeah. Like
Yeah.
I am mostly concerned about the affect of that person. So
Yes. What does that mean, Natalie? What is
I'm
affect?
concerned about the kind of just the
Demeanor?
general demeanor, like the
Mhm.
look, the
Behavior.
smell, the behavior, yeah. So
Mhm.
if there's severe lethargy, if
Mhm.
there's any sort of dehydration to the point that that person is either not taking anything in or is then expelling whatever they're taking in,
Mhm.
then I would get concerned. Like dehydration is really the only thing I am concerned about if there's a fever.
Okay.
That's really it. Because from a immunological standpoint,
Mhm.
if your body is determining that it needs to get its temperature up to a certain point,
Yep.
it knows depending on it's a bacteria or a virus or fungus or whatever, it knows how high it needs to get.
Mhm.
And if we interfere with that in any way, we end up not letting your body's cycle go through the whole it's not finishing the loop.
Mhm.
So then you end up with these recurrent fevers for multiple days. You end
Mhm.
up with kids who are really, really sick, end up getting more of like that chesty bronchitis type of sickness
Mhm.
because the body isn't able to clear it out when it's in the throat and the sinuses.
Yeah.
That's what the fever will do.
So a fever basically incinerates whatever pathogen it's detecting. If it's a
Yes.
bacteria, it's going to raise it to a certain temperature. If it's a
Yes.
virus, it's going to raise a little hotter.
Yep.
And if we interfere by taking a substance that's going to reduce the fever, a fever reducer, that's basically going to prolong the virus, the bacteria, the pathogen inside our body, allowing it to make you sicker.
Yep.
So the goal is to let that fever run its course, correct?
Ideally, hot
Mhm.
hot and heavy, and then it breaks
Yeah.
within a day. Like
Yeah.
that's unless there's something serious, serious, serious going on,
Mhm.
like a major, I guess, bacteria that your body's never seen before.
Mhm. But there
That
will be other signs that something
yes,
is wrong. Like Natalie was
yes,
saying, like the demeanor of the person will drastically shift if there needs to be intervention.
yep.
Now what's your take on like febrile seizures? Like how do we recognize what's gonna happen
Febrile seizures
in
typically
kids?
actually don't even happen at very high temperatures.
Okay.
It happens when the temperature shifts quickly,
Oh,
whether
it's a
that's
quick
up or
shift.
down.
Oh.
So sometimes with fever reducers, it
Mhm.
can actually cause febrile seizures
Oh, because
because
it's a quick shift.
it's a quick shift.
So your body's going into shock.
So right. So it's either like a very quick uptick that
Mhm.
then a lot of times doesn't get very high.
Mhm.
Um or yeah, it's usually the quick change in temperature,
Okay.
which could also be putting like a really cold cloth on the back of the neck or
Okay.
like a cold bath. Like
Mhm.
that could even
Trigger.
a tepid bath sometimes can trigger a febrile seizure if you're
Mhm.
trying to reduce that fever without letting the body go through its natural progression.
Yeah.
I also know febrile seizures typically are not damaging for
Correct.
the
They're
child's brain.
scary.
They're
They're
very
scary.
scary. I think the main part to them is that they're very scary,
Yeah.
and they are.
And you should seek some sort of
Absolutely.
medical. Yeah.
Absolutely. But typically
Um,
it's when you're trying to take that fever down
yeah.
quickly or it's jumping quickly.
Yeah. Yeah. And that's another problem. Like,
Right.
why is your body doing that
Right.
drastic? Yeah.
But high let's also discuss what you consider to be a high fever. And this
Yeah.
is not just my opinion. Like this
Okay.
is actually what
Natalie's leaving the opinion sphere.
this
Okay,
is
Natalie.
this is like documented. So if there is no fever until it is 100.4.
Mm-hmm.
Okay. So anything
Yes.
lower than 100.4
Mm-hmm.
is
Not a
not a
fever.
fever.
Not a
Sorry.
fever.
You have maybe a slightly elevated temperature reading that day,
Mm-hmm.
but it
Mm-hmm.
is
Or a false reading.
not, it is, or a false reading. It's not a fever. Sorry.
Mm-hmm.
So you do not need to even begin to think about
Mm-hmm.
being worried
Yep. Mm-hmm.
at 100.4. Okay. 100.4 could, I mean, I wouldn't even be, it
No.
wouldn't even cross my mind that I'd be nervous about that. Then we get up to like 101, don't care.
Mm-hmm.
102, don't care.
Do not care.
103, truthfully, don't really care.
Mm-hmm.
That's still a very moderate, considered
Yeah.
a moderate fever.
Yeah.
That's a very much so. Most people will get to 103 if they're really trying to knock something out.
I'm just gonna throw a disclaimer in.
Yes.
We're not talking about infants.
No, also true.
We're not talking about newborn infants.
No newborns. Like
No.
under, what is it, 3 months, 4 months?
Yeah, I think. Well, I was gonna say 6 months just because I like 6
6 months is safe.
So this is none of what we're talking about right this second is about newborns.
No.
Just so you know.
Also, very rare for a newborn to get a fever that's that high, especially if breastfeeding.
Yeah.
Another plug for breastfeeding. Your
Okay,
baby
so
will get all of the antibodies from you. Okay, anyway.
okay, now we're at 103. What do you think?
103.
103.
Don't care.
Okay.
I personally, I don't care.
Right.
However, if I had a lethargic, dehydrated kid in front of me
Yeah.
at 103, then I would be nervous.
Yes.
So, but from my experience, 103 typically alone does not create lethargy.
Mhm.
It's just, I don't see that.
Yes.
104, I'm starting to be like, okay, maybe let's
monitor this.
we'll monitor it. Maybe let's consider maybe some homeopathy.
Okay.
Certainly this entire time electrolytes are being pounded. Okay.
Yes. Yes.
Electrolytes, whatever sort of like immune boosters we can give,
Mhm.
which we will get into at some point.
Right.
We're going to
Right.
get into the immune side of it.
Yeah.
Another episode.
But this is more like triage.
Yeah.
Like, what do we do? And then how do we fix the problem?
Yep.
But we're like talking triage. When you have the fever, what are we doing?
Yep. And I think if I remember correctly, 104.5, 105, then you start to think like that's actually a high fever.
Okay.
So like I'm still not concerned all that
Mhm.
much. In
Mhm.
terms of like, there's no brain damage happening. There are no damages happening to the body if your fever gets up that high. It's not documented.
Right.
107, maybe, but
I was
also
gonna say
like
108, I believe, is when proteins denature.
yes.
But
So
I've
like
literally never known anyone to get 108.
that would
I've
be
never
like
seen a 108 reading.
severe sepsis that
Yeah.
you need to be somewhere else.
Yeah.
Other than at home. Of course. But like in terms of real scary things,
Mhm.
even febrile seizures don't happen at those high temperatures. It's
Mhm.
typically at
That
the lower
swing.
temperatures if you're changing it quickly.
Yeah.
So I'm just that's just me. I don't have fear around it.
Okay.
It
So if you notice that Jean is lethargic, you're doing electrolytes and water,
absolutely.
and you're doing what homeopathy?
If it got to that point and I was really trying to get the fever to come down like a degree or so,
Mhm.
I'd probably, depending on his mood,
Yeah.
I'd probably go with belladonna
Okay.
if I was really trying to reduce the fever. If there was a time when he woke up out of sleep and was like crying, nervous, scared, not
Yes.
feeling good, aconite would probably be
Mhm.
my thought on that one.
Yeah.
Or chamomilla.
Yeah.
Yeah.
Yeah. So the ABC remedy. So aconite, belladonna, chamomilla, you can give in combo.
Yeah.
And it's like a mother's best friend. If you're like,
Mhm.
ooh, are we fighting an illness? Are we teething? Are we like just like
Right.
like we don't know, waking up in the middle of the night crying,
Yep.
not really sure what's going on. The ABC remedy is gorgeous.
Mhm.
Again, aconite, belladonna, chamomilla.
Can we talk about teething for a second?
Sure.
Because
Sure.
this is a common one, and
Yeah.
there will be like a low fever, maybe
Okay.
even 102.
Okay.
Could be 101,
Cutesy.
102. The baby is pulling at their ear, maybe.
Mhm.
You're thinking, "Uh-oh, ear infection."
Ooh,
I'm not
antibiotic.
thinking that.
We're saying, "No, no, no, no."
This is what gets people down a really slippery slope.
Yeah.
You have 101, 102 fever, baby's pulling on their ear,
Mhm.
taken to the pediatrician. "Oh, there's a little fluid in there.
Mhm.
You better put him on an antibiotic."
Yeah. Catch it. Catch it early. Put them on an antibiotic.
Oh,
No.
no. Okay, so typically in these cases,
Yeah.
that baby is spiking a fever because a tooth is about to emerge, or maybe not even about. It could be like a few more days.
Also,
That
they're shoving
nerve
random things in their mouth, so their body's probably fighting something
No
off.
kidding, and that's fine.
Yeah, they're, like, shoving dirty objects in their mouth. Maybe you're getting a little
Absolutely.
fever from that.
Absolutely.
Yeah.
The body also will it gives a fever to protect against the opening of tissue that's
Mhm.
about to happen. So it's a preventative fever
Mhm.
to eliminate whatever bug might be getting
Hanging out
into
there.
the mouth. Yeah, in through that new tooth emerging.
Mhm.
So the nerve from that tooth that they're teething
Mhm.
goes right across the lip, right up the cheek, and goes right to that ear,
The ear.
that ear pain.
Ears.
So you take a baby who's potentially having a tooth come in,
Mhm.
they're feeling it in their ear. I'm not
Right.
saying that they're not feeling the
Right, right,
ear.
right.
They are, and
And they're
they're poking
self-soothing by
at it,
pulling
they're
on it.
pulling on it,
Mhm.
whatever. There may also be fluid in that ear,
Mhm.
clear fluid,
Mhm.
because either they need an adjustment, they need to get that eustachian tube
They need a
draining,
chiropractic adjustment regardless.
regardless.
When they're teething, they need a chiropractic
They
adjustment.
do.
Yes.
To help the cranial bones and the
Yeah.
facial bones all
And the
shift the way that they're
discomfort.
supposed to, and the discomfort.
Yeah.
So we have to get that fluid draining a little bit, but the
Mhm.
body will create again, that fluid is there as a result of the inflammation of
Mhm.
the tooth emerging.
Mhm.
If there is no redness in the ear, if there is no weird
Cloudy fluid.
looking cloudiness, exactly,
Mhm.
please do not put your child on an antibiotic for teething. Thank
Mhm.
you.
Yeah.
Okay, anyway.
End plug.
But that's then how you get
And the
antibiotic
cycle.
resistance, and you get in
Yeah.
the cycle, and then it happens again with the next tooth, and you're like, "Oh my gosh, another ear infection." And then without even really determining whether it's an ear infection at all,
Mhm.
they'll say, "Oh, well, if this happens again, you're gonna have to put tubes in the ear.
Right.
This fluid can't be there."
I know.
Meanwhile, I think the fluid is actually very protective,
Yeah.
but that's a whole other
We
story.
could do a whole we could do a whole ear infection podcast.
We
I
could.
mean, a huge population of my patients who start around the age, I would say that around the age from like 1 to 5.
Mhm.
A large portion of them, the mom is seeking it out because they're in the cycle of ear infection after tube after tube
Yep.
after procedure,
Yep.
and they're just like, "Is there another way?" And I'm
Yep.
like, "Yeah, we can get off the crazy train. We can
Yep.
certainly, like, remove ourselves from this cycle and have your body naturally healing." And, like,
It's
fevers
hard
are
though.
fevers are part of it.
Yeah,
Like,
they
you
are.
have to let your kid fever.
You have to let your kid be
Um
sick.
but also, I'll say, we have to observe our babies. We
Yes.
have to observe our children. You need to have eyes on your child. You need to have eyes on what they're doing, how they're acting,
Yep.
what their differences are. Your kid might be totally normal with 104 fever,
Yep.
but we have to be observing. We have to pay attention and be diligent.
That's the whole point is
It's diligence.
you could have 102 fever and your child's really, really struggling and you need to do
Mhm.
something
Right, but if we're not
sooner.
being diligent and observing and making note of what is going on, then we're never gonna have a compass that tells us and points us north.
Right.
If you don't know
That's
your kid's normal, you do not know where north
exactly.
is.
That's why I love homeopathy also, because
Mhm.
dependent on like you could have pain for multiple different reasons or
Right,
presenting in a very different way,
right.
and you can give a different remedy dependent on how
Yeah,
they're acting.
right.
The other half of it, the other side of the story that I learned from a homeopathy class that I took is that your child's recovery is somewhat dependent on your behavior as a caregiver.
What? Tell us more. I mean, I believe it, but I need to know more.
That's what I learned from this one class. It was like, what are the feelings of the caregiver
Mhm.
while this sickness or ailment or whatever is going
Yeah.
on? If you're really nervous about it, that child's gonna take on that nervousness, and you're gonna have to then treat that.
Okay, also Munchausen's by proxy.
Exactly.
If your
Mhm.
parent is like, "Ooh, you're sick, you're sick, you're sick," you're gonna be like, "I'm sick."
Mhm.
And it's quite literal, a psychological turmoil.
Yes.
That's
Yes.
crazy.
So, like,
I
health
can totally believe
anxiety
it.
and parental anxiety around sickness is potentially causing more problems for your child.
COVID, COVID, COVID.
E Exhibit A.
Natalie, I just can't be stopped today.
I love
You're
it.
gonna have to censor me.
And never, never cut anything out like that. No.
Just so you
Y
know, for our listeners, Natalie and I don't edit our podcast out.
No, we
We
kinda
don't
just
cut.
leave it. No, we talk,
We talk, yeah,
and
so you're getting, like, our full
if we say it
unfiltered experience. If we say it, it's
if
in
we
the
say it,
pod.
we say it. No going back.
There's no editing.
Okay,
Um,
what else do we need to talk about fevers?
okay,
There's a couple
so
things.
what about fevers in pregnancy? I think
Okay, yeah. Very real
yeah,
potential, scare, especially
yeah,
during first trimester.
right. You don't wanna heat your fetus.
No, I still am I'm still you still have to go by your feelings, okay? You still
Okay,
have to I'm still not as worried about the actual temperature, but
okay.
as we get up to like 103, 104, yeah, maybe you wanna start doing some natural things to help bring that down a little bit.
Yes.
Tepid bath, tepid washcloth on the neck,
Mhm.
belladonna, like, do the
Yeah.
homeopathy. Absolutely,
And adults
absolutely.
are a little bit more resilient to the shifts.
Yeah,
That's why you don't hear of adults getting febrile seizures.
right.
Um, but again, you don't wanna do anything drastic. You don't wanna jump in an ice bath.
Correct.
No. And the word tepid, Natalie, please describe for our listeners if they do not know what that means.
Tepid would be like a
Room
little more
temperature?
than room temperature maybe, like like 80 degrees, like
Yeah.
lower than our body temperature,
Yeah.
not cold, not to the point that they're shivering in the
Wait,
bath.
lukewarm? Lukewarm.
I guess like lukewarm, yeah.
Yeah, I like the word lukewarm. I also like describing outside weather as room temperature. I'm like, "Oh, it's perfect today. It's room temperature outside." Don't even
That's
know what
true.
that means.
Like
It just feels good.
a nice like 72 would be room temperature. So maybe
Yeah.
like
But a
lukewarm, I guess, is
72
a
a
better
72-degree bath would
no,
be
that's cold.
frozen.
Like lukewarm is a
Lukewarm.
better
Stick your hand
description.
in, and if it's a little
Yeah.
bit toasty, it's good.
There's also a old wives' tale of a sock trick, which really does work. And it's like you put a wet
Oh,
wool sock on
yes,
and then
yes.
cover it with a dry sock.
Yeah,
And that, honestly, from what I've
yeah,
heard, works wonders. So if I had to do anything, I'd probably start with that.
okay.
That would
I would
be it sounds crazy, but it from
yeah,
everything I've ever seen, it really does work.
yeah. The other thing is homeopathy is safe for pregnancy.
Yes.
It's natural substances, so it's substances from nature
Yes.
diluted down, and so
Diluted down to the 100,000th power.
yeah,
You
it's
cannot
very diluted.
take too much. You also
It's no,
there are no side effects.
no, and
There is not a side effect.
all of the homeopathy is safe for pregnancy. I mean, I probably wouldn't do a parasite homeopathy when I was
No.
pregnant,
No, no, no,
but,
no, no.
like, if we're talking, like, in the grand scheme of things that are like, readily consumable, you go
Yes.
to your local food store, health food
Yep.
store,
Yep.
they're gonna have the little blue bottles, is it Boreon? How do you say it?
I say Boiron.
Boiron?
That's probably not what it is. There's
And they're
also
these
Alois,
little
there's, like, all kinds of
yeah.
Olois, whatever, I don't know.
Yeah. So they're these little blue vials. They kinda look like the size of a chapstick,
Yeah.
and they have sugar pellets in them. And those sugar pellets are then rolled in the hyper diluted solution, and you take a couple of those every 15 minutes, and it's safe for pregnancy. So you could do a
It's either gonna work or it's not.
yeah.
There's no downside.
Yeah, and so you could dabble in a little bit of homeopathy for fever reduction
Yeah.
and feel confident that you're not over inundating your liver, that you're not passing anything through the
Yep.
placenta. Like, it truly is very low risk when we're
Yep.
talking about, like, how do you manage symptoms? Again, this is not, like, tracing it back to why we're having it. It's like when
Right.
you're having it, how do we manage symptoms?
Yep. Yep. It's truly just a symptom management
Yeah.
when it's necessary. It's not a
Yeah.
preventative. It's not a that's not what it's
Also,
there for.
homeopathy is quote unquote over the counter. You can just go to the
Yes.
store and purchase it. Like, it's easily accessible for most people. That's why I'm
Have
kind of
it
getting at this.
yeah,
It's
have it
like
for when you need it.
I just stock up our quote unquote medicine cabinet in advance.
Yep.
I know what season's coming and I'm like, okay, so I think I'm gonna need like some more saline nasal flushes. I think
Yep.
I'm gonna want like X, Y, and Z. Get it before you need it.
Yes.
I did
I'm
that with like I crazily did that with COVID.
I did too.
I got ivermectin, I got
Yes.
nebulizers, I got, Apex water, I made myself a COVID kit, a quercetin,
Yep.
all the things.
Yep.
I made each kit for every household that was in my, like, immediate circle.
Yes.
Natalie, the day my ivermectin was prescribed or, like, my prescription was ready, I got COVID.
Of
I kid you
course.
not. But I had prepped in advance. I put in the work before I was sick,
That's exactly what you
and I
have to
reaped
do.
the benefits.
Yeah, because you wanna have what you need when you need
Yeah.
it, and
Yeah.
when you're sick and you need it and that's what
It's too
homeopathy
late.
is.
Yeah.
In those acute situations, that's
Yes.
when you use homeopathy. It's
Yes.
not if you have a chronic condition, you have to actually see, like, a homeopath
Homeopathy. Yeah.
for, like, condition what is it? Constitutional care
Yes.
is what they say.
Constitutional care is chronic conditions that you're seeking homeopathy care for.
Yes.
When we're talking about acute symptom relief and acute, like, symptom management, we're talking over the counter homeopathy,
Yeah.
first aid kits. Like, I have a first aid kit, you have a first aid kit.
Mhm.
But again, like, I also have the Boreon, like, I shove in my purse if I need it.
Yep.
So yeah, homeopathy is great for babies, pregnant patients, or pregnant people. Sorry. I'm
Everybody.
like, I call everybody a patient.
Everybody's a patient.
Everyone's a patient of mine. Um,
I will also say, if needed, like if
okay.
something was getting really high,
Yeah.
then I would start doing like colloidal silver or like a antibiotic alternative
Okay.
then at that point.
Mhm.
Because then like your body's really it's trying to fight something, you
Yeah.
know? So like giving some other things that could maybe help to kill off
Yeah.
that particular bug,
Yeah.
I think is warranted at that point.
There's
I'm
2 I
always
know
giving
of.
herbs, but
Yeah. I love herbs.
yeah.
There's 2 I really like, that are safe for kids and adults, both from Earthly. Feel Better Fast
Yes, love it
tincture.
for everything.
Seppi knows. Like, I'm like, "Okay, time for some medicine." Like, if he's
Mhm.
feeling a little bit like, "Ooh, I don't know," or he's having a really tough day, and I'm like,
Yep,
"Okay, something he needs a little boost." Feel Better Fast, and then they also have an immune biotic.
yep,
And it's kind of like a nature's antibiotic, if you
yeah,
will.
yep.
Um, but is there any herb that you like?
Um, I typically anything with echinacea, which the Feel Better Fast
Mhm.
has echinacea, I'll usually
Mhm.
do an echinacea tea along with it,
Yeah.
something that has that. I think that's really powerful for
Mhm.
bacteria and virus,
Yeah.
which is funny because my grandma always was like, take your echinacea,"
Dude,
and I'm
if
like,
you've ever taken echinacea straight,
"Oh,
standard process would just
oh."
rip shots at us
Oh my
at all those
gosh.
seminars. I'm like,
It's
I keep getting trapped into these echinacea
horrible.
shots, and I
I
just
know.
my throat is completely numb.
Or they'd tell you to take the capsule or, like, the pill and
Mhm.
suck on it for a little bit
Oh, I've never done that.
to really taste the alkaloids or whatever the heck is
Oh,
in the
goodbye, good
echinacea.
night.
Holy cow, and then your
No,
whole mouth
thanks.
is numb.
Yeah, and I'm like, "Is this" the first time I tried
Like, "Are we
echinacea
is this okay?"
liquid, I literally was like, "I think I'm allergic," because I thought my throat was closing.
That's what it feels
It
like.
feels like you're having an allergic reaction, and it's like, "Nope, that's what it's doing."
But, the other like, the Feel Better Fast has a very little
Well, yeah.
amount, you
Like,
wouldn't
Sep
even
loves it. You
know
would
yeah.
never know.
No,
Yeah.
Jean takes it all the time.
Yeah.
I love the propolis sprays.
Oh,
Beekeeper's
yeah.
Naturals propolis, I love those.
I stay away from propolis because I'm allergic to bees,
Oh,
and
okay,
they just
smart.
kinda say, like, "Be a little
Just be
weary."
cautious.
Yeah, and I feel like the
Okay,
only time I would take propolis is if I was already, like, a little bit compromised.
okay.
So I just worry that with some compromised
Mhm.
immune and then I'm taking propolis, I'm like, So I
Maybe
stay
not.
away from it. But I gave Danny propolis cough drops the other day.
Yeah, I
He was
love
having, like, a
those.
little bit of a sore throat, and I
They're so
handed him
good.
some honey propolis.
Yep. I
What is it?
love
Beekeeper's
Beekeeper's
Natural?
Naturals.
Yeah. Yeah.
I love thieves oil.
Oh,
I
yeah.
diffuse that all over the place.
Yep.
My aunt also would tell me she would put a drop on her thumb and stick it at the top of her mouth.
Yeah.
And I was like, it tastes disgusting.
Thieves.
Mhm.
Yeah.
But
Not the cleaner. Don't stick
no,
the
no,
cleaner.
no.
Just the pure
Pure
essential
oil.
oil.
Just if you're sick, I mean, it's just another thing.
Yeah, it's
So
just little
if
tips,
there's
little tricks.
anything going around, like
Mhm.
I'm doing it. I'm doing all of it.
I like to do,
Um,
colloidal nasal spray
yes.
if I'm exposed to somebody who's really sick,
Yes.
if I
If
know
you're
I'm
on an
going in an airplane.
airplane, yes.
Oh, when I hit that sky, those nasal drops
Yep.
come out.
Even I'll do like a combo. There's a xylitol, propolis, herbal that I like.
Nasal
Again,
spray?
Beekeeper's Naturals.
Oh,
Anything with xylitol
okay.
will clear the nasal passageways and actually kill. Xylitol will kill bacteria and virus
Whoa,
before it gets to the rest of your body.
whoa.
So nasal
I'm sure
sprays
there's an age limit to
are
that, right?
xylitol,
Like
yeah, but like a saline spray you can do with babies
yeah,
if you want to.
I do
So like
saline.
saline in general, you're gonna be flushing
Yeah,
whatever comes into contact in your sinuses, flush it out before your body has a chance to
yeah.
even react to it.
Do you guys all remember when you were little and your mom was like, "Oh, you have a sore throat, go gargle salt
Yes,
water?"
gargle salt water, and I
Okay,
was
that's
like,
saline.
"No, I don't want to."
That's saline. So when you're shooting saline up your nose, you're clearing and
Yes.
flushing out those tissues, and it's antimicrobial.
Yeah.
So,
It's
like
just like a good
yeah.
practice. Every once in a while, a few times a week, just
Mhm.
do something. But then yeah, the silver, I like the ACS 200 nasal spray, colloidal silver nasal spray
Oh, I just use
because it's
the normal one, uh,
the sovereign silver.
Sovereign Silver.
Yeah, and that's just silver, which is fine.
Yeah, yeah.
I
What's the
the
brand you
other
like?
one, ACS clinical or ACS
What's in
200.
it? Is that the one with xylitol?
That one doesn't I don't think has xylitol. Let me look. It has herbs in it too.
Oh,
So I
cool.
really like that one if you're really trying to kill stuff.
Yeah,
Like if you have a sinus infection or you have um anything more than just like you're trying to just clear your sinuses out,
yeah,
it kills stuff.
yeah.
Silver nasal.
I'm just gonna beat a dead horse. You guys
Please.
have to you have to purchase all of this in advance.
You have to.
This is not like, I have a sinus infection, now what? This is
Yeah,
like,
you need to
okay,
have it.
this is my medicine cabinet, and these are the things I have, like clear tubs, and I have, like, cold flu, I have allergy, I have them all labeled out, and then I have all our remedies in each one, and it's like, when Sep has something, I'm like, "Okay, I'm gonna go to this department of my
Yep.
medicine cabinet and see what we have and see how we can help him." Because at
Yep.
2 AM, you're
No,
not
you don't want to
ordering
think.
something,
You don't want no, and you
and
don't even
that's
y-
why people reach for Tylenol because
right.
they're
They
not
don't know what to
prepared.
do.
Yeah, they're not prepared with alternatives.
Right. I have
Alternatives yeah.
something for everything.
Yeah.
There's not a ailment on the planet that I don't have something for.
We also have an opinion for everything.
True.
That's kind of our personalities. We have something for everything, whether it's an
Something for
opinion or an
everything.
herb.
Also, if anyone wants like a list of what like I have a running list of like
Yeah,
what I would keep
in
in
our medicine
our
cabinets.
medicine cabinet
Mhm.
for any sort of thing.
Yeah.
Let me know, I'll send it to
Yeah, let us know. We will,
you.
send you a PDF of our medicine cabinet.
Yep.
Love it.
'Cause that it just helps.
Yeah.
Actually give it every time I go to a every time I go to a baby shower.
Do you give a medicine
I
box?
print sometimes,
Oh,
depending on the
cute.
person,
Yeah. They
if
have
I
to be
think they're gonna
ready
use
to
it.
receive. Yeah.
Yeah. But I'll print out my list
That's cute.
because it's just, like, helpful because half the time for
Yes.
little babies, infants, there's nothing you can give a an infant
Right.
if they're sick
Right.
except for homeopathy
Homeopathy. Yep.
and
And
vitamin D drops. Like, there's
saline.
and saline, yeah,
Yeah.
like, that's it.
Yeah.
So it's nice to have maybe like a couple more options.
Yeah.
So I have on the list like what can you give to a 1 month old? What can you give to under 6 months old?
Yeah.
What can you give past 6 months old?
Yeah.
So there's a
Yeah.
lot. Okay,
Oh,
the
I love
ACS
that.
nasal spray.
Yeah.
The brand is Results RNA is what it is. It has the silver, it has quercetin, elderberry, chamomile, echinacea, and rose hips.
Ooh, cute.
So it's like a good herbal with silver.
I'm gonna have to add that to my list because
I like that
we're
one.
coming up on a season of which we call cold and flu season.
Yes.
More importantly, it's a season of inflammation.
Yes.
We are inundated with inflammation from holiday drinks, holiday parties, holiday treats, holiday candies, holiday
Yeah.
baked goods, and
Stress.
we're stressing our body, and that
Yeah.
stress is coming in the form of things we put in and around our body, the smells,
Mhm.
the candles,
Oh,
all the scents of the
the
holiday, the
chemicals.
chemicals we're exposed to,
Oh,
the baked goods, the alcohol, all that, which reduces our immune response,
yeah.
and then
A
we're getting sick.
and the change in temperature.
Yeah.
The
Yeah.
change in season is really, at least
It's
from like a
hard.
Chinese medicine perspective,
Yeah.
that's what creates sickness.
Yeah. Oh, speaking of Chinese. So,
Yes.
again, like if you're sick, trying to take preventative measures, warm fluids in the body
Yes.
are known by the Chinese medicine practitioners and like people who practice
Mhm.
that to absorb moisture in the body and quote unquote dry it out.
Yeah.
So warm sipping broths,
Yep.
warm teas, warm soups.
Yep.
Stay away from cold things. Like,
Herbs
yeah,
work better also when they are warmed.
yeah.
So they
It also makes sense. Like, you don't crave salad when you're sick.
no.
You're
So
craving a
true.
cup of bone broth.
Yep.
Well, I am at least.
Exactly.
And so we
I've
wanna the goal is to reduce moisture in the body
yeah.
to like
Yeah.
so warmth.
I also wanna say the classic, like, old school chiropractor technique for fevers or what they would give was
Yeah?
calcium lactate.
How do you take that? What
Sh
is that?
And it's like a pill, standard
Is it?
process makes it. Yeah,
Oh,
and that's like a classic fever remedy.
really?
Yeah,
I've never heard of it.
calcium lactate. So
Wow.
that's safe for pregnancy also, and
Okay,
that's a really good one.
okay. And you can get that from standard process?
Yeah, I'm sure there's other ones too,
Yeah, yeah,
but off the top of my head.
okay. All right, so that's fevers. Let's touch on pain. Because like the whole premise, the big umbrella picture is that we're trying to provide an alternative for pregnant people and kids
Yep,
from taking acetaminophen slash Tylenol that is quote unquote supposed to help reduce fever and help with pain.
right,
So what are we doing? What are we doing these days for pain
right.
to prevent the pain, but also stop the
Mhm.
pain? Keyword prevent the pain.
Prevent the pain.
Yeah.
Prevent the issue.
Prevent the issue.
Nourish your body so it can heal
Mhm.
properly.
Mhm.
Get adjusted, please.
Yeah,
It's just like, at this point, I
I
don't
know.
know.
I
I
know.
don't like, come on. Like, if your body hurts you,
Get
figure
adjusted.
out why. Like,
Yeah.
get adjusted. Start
Mhm.
there.
Now, if you're not familiar, chiropractors have, specialties. There's a specialty in prenatal chiropractic.
Yeah.
It's called the Webster certification. You can find a chiropractor in and around your area through the Webster, certification
The
and
ICPA. Yeah.
ICPA. I mean, if you won't remember that, but if you
No.
type in like Webster chiropractor near me,
Yeah.
there's a database of Webster certified chiropractors that will pop up in your zip code.
Yeah. And for the most part, they
It's
at least
yeah,
have done extra training.
exactly.
At least one class of
Yeah.
extra training.
Check their website. Their website
Yeah.
should jive with like prenatal and
Yeah.
pediatric family-based chiropractic. If they don't, maybe find someone else.
Yeah. There are
But
so many options
yeah,
for pain in pregnancy. Like,
there are so many options.
you do not have to deal with it.
No,
Uh,
and you
uh,
also don't have to resort to Tylenol. There are
no.
so many alternatives.
Yep. So
Um,
I mean, arnica is the classic.
Classic. It's
Arnica
pretty
is,
much like the most well-known
I would say, and for
homeopathy.
bruising, like, dermatologists use it
Mhm,
at post, like, Botox injection. They
mhm.
say, "Put some arnica cream on or take arnica and you
That's
won't bruise." That's the
ironic.
gateway. It's the
I'm
gateway for people to be aware of homeopathy is
yeah,
arnica post Botox,
that's
which
crazy,
is
the
just so
irony of that.
funny. It's so funny. So there's so many like dermatologists or injectors I've talked to, and I will say something about homeopathy and say like, "Oh yeah, arnica or whatever." And they go,
Yeah.
"Oh yeah, arnica I use all the time." I'm like, "Yeah, that's homeopathy. Welcome. Welcome to
Welcome.
being a holistic practitioner."
Yeah, after you inject your patient with pure poison, here, rub some arnica on it.
So funny.
Love it. We
So
love a good
that's
moment.
arnica is more for like a deep healing, bruising,
Yeah.
maybe a laceration, anything that requires like tissue healing
Yeah.
is really what arnica is for,
Yeah.
not necessarily for like generalized pain or headaches or something like
Mm-mm.
that.
Because typically people are using arnica in the most used forms as a cream or a gel.
Right. So like it can be probably helpful for arthritis too a little bit, like if it's
Yes.
a lower dilution.
Yes.
So that's an option for general pain, I suppose, but
Yes.
typically it's for something that requires healing.
Yes.
Then we have like hypericum,
Yep.
which would be more of like a nervy pain,
Okay.
at least from my understanding of it.
I believe I use hypericum in stomach bugs, right?
Possibly,
Because it's like extreme stomach pain,
possibly, yes.
right?
Yeah, it's more of like a sharper pain.
Yeah.
Hypericum
Okay.
would be like a sharp that's the characteristic of it.
Yeah.
So
Yeah.
you can use it for a lot of different types of
Mhm.
things, but that's like if it's sharpness,
Mhm.
shooting,
Mhm.
whatever, like that would be hypericum.
Okay.
Um, nettle, stinging nettle, like in a
Mm.
tea or a tincture is
Yes.
incredible for pain, and
Mhm.
that's general pain, headaches, bone pain, whatever,
Yep.
whatever it may be.
Yep.
I'm
Nettle
trying to
tea is
think.
a common recommendation in pregnancy.
Yeah. Yeah, that one is
Stinging nettle
like
tea.
stinging nettle. That one's really, really
Mhm.
powerful, actually.
Mhm.
Works really well.
Mhm.
Not necessarily for pregnancy, but if we're having any sort of like arthritic pain,
Mhm.
don't sleep on the nicotine patch.
Oh, we circling
Coming back.
back.
Coming back.
I didn't know you were gonna drop that on us,
I
Natalie.
know,
Yeah,
I'm
the
sorry.
nicotine patch. Do you want a little anecdotal story?
Yeah, I do.
Dan had mommy's wrist, and it's now gone.
Oh my
But
gosh.
I will say, we were doing red light
You were doing a lot.
therapy,
Mhm.
nicotine and adjustments, and CBD cream. But the nicotine was like a daily thing for Dan. Like he
Yep.
is wearing a
And you
daily
can like
nicotine patch.
put a patch right on the area of pain too.
Yes. His
Just
wouldn't
FYI.
stick. His
Yeah,
wouldn't
I know
stick
it's
because he
hard.
was hairy,
Yeah.
but still, he would
So
put it on that side of his body.
mhm.
Yeah.
So that's another option. Um, what do you have for pain besides what we just said?
Pain. Um, ooh,
Depends on where it's coming from.
I guess so. So it's yeah, I think we need to do again observation and diligence. I
Yeah.
think we need to check in with ourselves. Do we have hip pain because of the chair we're sitting in when we're pregnant? If it's not supportive, if it's too squishy, are we working from home and sitting in a deep set couch that's like
Mhm.
sucking us in? Your body is going to ache. It's going to be just miserable
Yeah.
if you're not supporting it. So, typically, a firmer surface, one with more support.
Yep.
Um, I'm looking at it from like, how can we switch your ergonomics? How can we switch your
Yeah.
lifestyle to reduce the gas pedal, right? The gas
Yep.
pedal is like, why do we have the pain? And then from there, we can do more of the things that you and I had just talked about,
Exactly.
like supportive methods. But I love brainstorming with a patient on why.
Agreed.
Like,
Like there's
why do we have
always
the
a
pain?
reason. Sorry,
There's
there
always a
always
reason.
is.
Again, seek a chiropractor. If your hips are aching you every single day,
That's
your
not
pelvis
normal.
no, it's not normal.
That's not
Pregnancy should not hurt.
no.
You should not be in pain.
No, that is not normal.
That is not
There's
normal.
something going on,
Yeah.
whether it's a pelvic floor therapist you need, whether it's
Mhm.
a chiropractor, whether it's whatever. Maybe you need to
Mhm.
stop doing something you're doing for a little bit.
Right.
Maybe you need to look at the way you're getting in and out of your vehicle.
Mhm.
That's a
Yeah.
huge one.
It's a huge
Anytime you're
one.
like opening up and splaying your pelvis
Mhm.
can be causing instability and pain.
I've talked with a couple patients recently about carrying a toddler up and down a
Oh,
staircase
yeah.
while you're pregnant.
Oh, yeah.
Screech
on the same side every time.
every time.
Same side.
Oftentimes resulting in a breech baby
Yes.
because the breech baby
Yeah.
is being shoved on the other side of the belly and won't flip.
Yes.
So if you have a toddler and you can help create independence of them going up and down the stairs by themselves, yeah, it's going to take longer.
Yep.
But at what expense? Are
Yep.
you going to be in chronic pain because you can't be bothered to wait another 2 minutes to go up and down a staircase?
I know. We have
I'm
to
sorry.
make
I'm
smart
not being
decisions.
very empathetic right now. But
But it's
but
true.
I'm very passionate about diligence. I'm very passionate about observation, and I think we need to do a better job of encouraging our mothers and encouraging ourselves to observe.
Yeah. I
We
think
stopped observing.
we've become so disconnected
Yes.
to, like, something is causing this. We don't
Yes.
pay attention.
No.
So there's a reason for everything. Just
Yes.
take a moment, think about what you're doing,
Yes.
think about your environment.
Mhm.
There's probably something that you could change that would
Yes.
help with
Yes.
what you're doing, but
Yes.
we're so used to being able to just reach for something
Mhm.
to fix our ailment that
Yes.
we don't ever try to actually fix the problem,
Yes.
and it's infuriating.
Now, I will say, in the event that you're in a work environment, okay, let's give an example. You're a nurse, you work 12-hour shifts, and you're 8 months
Okay,
pregnant.
fine.
Okay.
So roll a belt,
So, yes, you're going to use a supportive device,
yeah,
whether that be a supportive garment, which
a belly band,
a belly band.
whatever, yeah,
I like compression shorts that are specific to pregnancy.
yes.
I had those. A Sorolla belt, which is going to help support the pelvis and the sacrum,
Mhm.
and the hips. You're gonna you're gonna evaluate what kind of shoes you're wearing.
Yes.
Okay, you're gonna evaluate if they're beat to shreds or if they're too supportive or like I don't want to say too supportive, but like if they're not the right shoe and you're standing for 12 hours,
Mhm,
you're going to be in a world of hurt.
mhm.
Again, hydration. Are we
Yes.
hydrated? If our tissues are dehydrated, they become beef jerky.
Yes.
I tell that to all my pediatric kids. I'm like, "Have you
I
ever eaten beef
love
jerky?"
it.
And they're like, "Yeah." I'm like, "You're beef jerky. You drink
Mhm.
1 cup of water a day." Like, hello? Like, I can purchase you at this
I'm
store
gonna
for
use that.
10.99. Like,
I'm gonna use it.
dehydrated tissue is beef jerky.
Mhm.
So, if we drink water, we can fight so many
So many.
pain signals, so
It
many.
sounds insane that really it's like, "Did you drink
Is it
water
that
today?"
simple? Is it
But, like,
could I be a life coach?
there's a
Drink more
lot
water.
there's so many things. We have to do a water episode still.
We do. We
I
have so
know,
many
it's
things
on
we
the
have to talk
docket.
about.
It's so many things.
Again, the nurse, the shoes, the supportive garment, the hydration, the nutrition. Nutrition, nutrition, nutrition. You need to be eating enough protein. You need to be eating enough fat. You need to be getting your electrolytes
You
in.
need to be
Like,
eating connective tissue.
yeah.
Hello,
Hello.
collagen, bone broth, meat cooked on the bone, please.
Jelly. Yeah, like we have to observe the fact that if our tissues are aching, what are they asking for? Are they
Yep.
asking for rest? Are they asking for nutrients? Are they asking for support? Are you mentally checked in or checked out?
Mhm,
What's going on?
mhm.
And I'm sorry, but Tylenol's not going to fix your problems.
No.
So, we have to go back to the ground basics. We have to go back to the building blocks of what is our body asking for? And that's the same thing that goes for our children. What is our children's body
Yes.
asking for?
Yes.
How can we observe that? How can we best approach it that's going to support them and it's not going to diminish them?
Yep. Otherwise, you are doing yourself and your child a major disservice.
We deserve
Sorry.
better.
Yeah, we
We
all do.
deserve
We
better.
all can thrive.
It's crazy. I truly wish people were better at observation.
I know.
And
We
I
have the
can't
ability. We
I can't
have
say that more.
I know. We can do more. Sorry.
Yeah.
We have the options. There are
Yes.
other things out there.
Yes.
If you open your eyeballs and say,
And it's not political. I'm sorry.
"No, this is like old news." I'm sorry. Like this isn't new.
Not new.
There are so many other options out there.
Yeah.
So if you need hand holding, this is the
Right.
one area I will hold your hand.
Yes. I'm very passionate about the why. And that's I think what helps make a chiropractor a really good chiropractor is they're passionate about the why. They're not just passionate about, oh, your low back hurts. Let me just like adjust that low back. It's why does your low back hurt? Yes, let's adjust you because obviously
Of
that's like
course.
our bread and butter. But how do we stop the cycle?
Yep. We have
How do
to
we stop the
think
cycle of
better.
the ear infections? How do we stop the cycle of the achy hips when we're pregnant?
Yep.
What are we doing?
Yep.
So that's my soapbox.
I'm with you.
I'm passionate.
I'm with you. This is great.
This is what would Natalie and Felicia do? Take one. Again, this is unedited.
Medicine
so like
cabinet.
this is just us spewing from the heart about like what is in our home. And then we're trying to help encourage others to like open their eyes to have alternatives.
Yep.
I don't know. But like Trump said, I'm sorry, I have to. If you can't tough it out, what was he doing?
Oh my God. I can't.
If you can't tough it out, then take it, I guess. I'm like, oh gosh.
Delivery.
The delivery.
Goodness
So hopefully our
gracious.
delivery was a little bit more graceful, a little bit more.
Maybe.
Well, I say empathetic. I don't know. I could have been more empathetic, but I'm highly passionate and I really truly think that we can do better for ourselves and our children. And that's why Natalie and I are doing this podcast. It's really to just open everyone's like minds up to there are options.
Yep.
And
We have all the power.
You can choose to be
And
different.
also, you can choose to take Tylenol.
You can. Oh my God. Newsflash. It's still available for purchase.
It's really like, okay.
At your nearest drugstore.
If you know all the info and you decide that you need to take it,
it's your informed
take it.
choice.
And you know what? That's okay.
It's your choice. You're allowed to take it. No one's telling you can't take it. We're just giving you options. If you're just slightly questioning, maybe I shouldn't.
Right.
So
I was gonna say that you can take it and maybe your child won't get autism or maybe they will, but we don't know.
We don't know. And honestly, unless you use your own discretion, we can't help you.
Yeah. We don't know. There's
We
so
don't
many
know.
things that we don't know. And that's science in general.
Yeah.
Like you have these
The point of science is that nothing is proven.
You have a new study that comes out and then you have this other one that contradicts that study. And then you have somebody who's funding another study that
and then if you're the CDC, you can throw out data points and call it a study.
Right. Like science is not settled. There's never settling of science. That's not science. That's not how
the second somebody comes up with something in science, somebody else is out there to disprove it. That is the point of science.
So take in all the information. Don't rely on one study to make any decision.
No. And Natalie and I are not a study.
No.
No study here.
So it's just, we don't know, but just maybe use a little caution.
Yeah.
And maybe don't down an entire bottle of Tylenol while you're pregnant. Okay.
Yeah. Thanks.
Thank you. Bye.
All right. We'll see you next week.
Hope you loved our chit chat. Remember, while we may be doctors, we're not your doctors. And this podcast is not supposed to replace advice from your own provider. Please don't take our opinions as medical advice and talk to your doctor about what's right for you.
That's a wrap on this week's episode of Functionally Feral. If you're loving the realness, the rituals, and the chaos that comes with raising feral children while building a business, go ahead and hit that subscribe button. Share it, tag us, and don't forget, being feral is functional when you've got a plan.